Healthcare and senior care is fraught with problems and challenges, but we're also seeing some amazing new clinical treatments and resources. This show will help illuminate and uncover the good, bad, the ugly in order to equip patients, families, and other healthcare providers. Welcome to Senior Care Confidential.
Hey there, Brian. How are you today?
Good, Joe. How are you doing?
Doing good. Just thinking about all the food I want to eat and all the weight that I may gain in the next couple of weeks.
With Thanksgiving coming up.
Kind
of prompted today's discussion as well.
It did. Yeah. And so I wanted to talk about something, Hollywood's latest diet craze, the Ozempic shot that is just capture the world by storm.
Yeah.
And we just want to talk about Ozempic and our senior client. And is that going to be helpful for our senior client?
Yes.
So let's talk about Ozempic. So right now it's a shot. You can go to your doctor. I know my son, who's a physician, he told me, he goes, Mom, all these doctors can do moonlighting and sell these Ozempic shots. And, we could do really well, additional, everybody wants the Ozempic shot. Yeah. So, and basically what's happening is you lose weight very quick. I have a good friend who's a nurse practitioner. She lost 22 pounds in 3 months and she felt great. She ate, but she didn't get full. There were really, she told me that as far as side effects, the only thing, she felt full. She just wasn't hungry.
Yep.
And she wasn't thinking about food and what am I going to snack on tonight?
That's my understanding of it too. We have a few patients that are on it and they're seniors, right? I don't know how many friends that are on it, but we have some seniors that are on it. And my understanding from them is it makes you just feel full. I think it's supposed to slow down your metabolism. Slow down your metabolic tract or your digestive tract, which makes you feel fuller. I think it does something with leptin and some other things. It drives more glucose into the actual tissue, but the design of it was initially just to help the pancreas increase its insulin production to help with diabetics. And as they were testing people that were diabetic, they found, oh my gosh, there's this other weight loss thing.
It's a great side effect.
It's kind of like Viagra, right? When Viagra was used for like heart related stuff because it increases nitric oxide. I think I'm correct on that. And then it had these other fun side effects. And so all of a sudden that thing took off as well. So it's the new version of the blue pill.
That's right. And I know doctors are prescribing, you go in, just get a lab draw, and then there you go. They will give you an injection. Basically, you can go into the doctor's office once a week and have it done, or you can get that first injection and then get it done weekly and do it yourself at home.
So you can do these yourself.
You can do it at home and it's sub-Q. So it's just going to be in the lining. It's not a deep shot. So
it's like subcutaneous?
So it's subcutaneous.
Oh, okay.
Yes.
So not bad. Okay.
Yes.
So I got a question for you. So there's been a lot of news articles on supply. Are you finding that the supplies are still dwindled or are they back in stock now?
I haven't heard anything about supplies, but I do know insurance is not going to cover that whole shot. And I know some people are paying as much as $1,500 a copay.
Yes.
So be very careful and ask your doctor, as they are so willing to prescribe it. Yeah. But find out what you're going to be paying out of pocket for that.
There's a couple other drugs that are kind of similar in one starts with a W, but they range around $1,000 per person per month, which is pretty expensive. That's like it's a mortgage payment. Well, maybe not now with inflation, but it's still half a mortgage for these kind of drugs. So it's expensive, and it's a lifestyle change too. In fact, they say that the drugs are not as effective without the lifestyle changes. So you're going to find that your nutrition is going to change. They're actually encouraging you to be active with it, and so it does seem to help promote for those people who have sticky weight issues. It does seem to help promote those things. And honestly, a lot of us are economically motivated. I know I am. And so if you're spending $1,000 a month on a drug that's supposed to help you, you're going to stick to it.
That's right.
Yeah.
And
your diet's going to change.
says.
Your exercise level is going to change. Yeah. I think that the one thing that bothers me a little bit about this drug is anytime you change the body's, I guess, chemical makeup, because the design of it is to make the pancreas more active in producing insulin. And so what happens if you go off of it? And they don't really know yet because the drug's only been around for a couple of years. And then you've got because it's only been around for a couple of years, there's no like longitudinal studies on this stuff.
I know.
They don't really know. They think that seniors may be more susceptible to some side effects just because we naturally are as we get older. They may be more susceptible to some side effects. But again, these are the things that they just don't know. And I saw just last month, I think it was in September, the FDA has now put a black box warning. I think it's literally called the black box warning, where there's been, I want to say it's pancreatic tumors in rats. It has, but they say we've not seen this in humans yet. But FYI, we have seen this happen in mice and rats.
Okay, but then you could, we talked about this earlier. I had 2 grandmothers, never had a drop of alcohol.
Right.
Grew up Southern Baptist, but I'll tell you, those 2 swore by tabs. They swore by their saccharin and swore by their sweet and low.
Yeah.
Both lived to be 97 and 98. And that was supposedly one where rats wound up with cancer with saccharin.
Right. That's right.
And so, I think right now there's so many people with weight issues.
Yep.
And it is so hard to make all those changes, that lifestyle change. So to me, if you've got something that will kickstart it and motivate you, why not?
Yeah. The only problem with it, it's not really a Kickstarter though, because you're supposed. The design is you're supposed to be on it for long term.
I know. Yes, sir, Mr. Physical Therapist.
That is a huge economic commitment.
I know.
Monthly for long term.
I know.
There is some. I think there's some positive developments that there are some generics that are going to make their way through the market, which should reduce the cost quite a bit. But yeah, have you seen the studies on metabolism as you get older? So it's fascinating when you get, I think they call it the middle-age spread. So we a lot of times we'll say, because we're in our 30s and 40s and 50s, our weight is increasing and our waist is increasing because metabolism is slowing. And I've actually showed numerous studies where that is actually not the case. Your metabolism actually does not slow. It does not slow until 63, I think is where they see the average reduction. And what's interesting is what they have found is the middle-age spread is not metabolism related. It's actually our own activity level related.
Wow.
Well, because we are in an IT society now, right? So a lot of us have desk jobs. You and I don't, because we're out physically working with patients. But a lot of people have desk jobs, whereas before a lot of manufacturing, a lot of outside stuff, and so a lot of that has to do with that. And so the level of energy expenditure on a daily basis is not what it used to be.
That's interesting.
Yeah. And then what they find though later in life, though, they do find that there is a reduction in your metabolism as you get to 63 and beyond. And it's interesting because they measure the total energy expenditure in terms of like your basal metabolic rate, which is like that's the amount of calories you burn like at rest. And then they look at your overall activity level and those kind of things. And they have found that some of the metabolic changes as you get older is in fact due to lack of moving around like you used to, because at 63 or 73 or 83, you're not moving around like you were at 23. But that some of it is actually due to the organs are actually, they're pulling more energy from the metabolism. How do I say that? The internal organs are having an impact on the actual metabolism itself and slowing that down. And so it's fascinating when you start looking at that stuff. And so some of us, as we get older, having a little bit of help from something like an Ozempic or, one of these other drugs that increase your metabolism and increase, insulin production could be helpful in reducing weight.
So for somebody that doesn't want to take Ozempic, but knows they've got to lose weight. And Brian, I know you as a physical therapist work with clients, and that's the number one thing. It's the weight on knees, and it slows you down, and you sleep worse, and you breathe worse. All these things with the weight loss contributes to all these other problems. So what do you say as a therapist? What is the best way to ease into having a new normal, a lifestyle change?
It's a good point. So, we'll go with the weight and the joint issue. So there's, depending on the surgeon, let's assume you have somebody who's got really bad arthritis in their knees and their hips, and they are really kind of due for a knee replacement or a hip replacement. There are BMI scales where the surgeons will not do a surgery if your waist size, if your weight is too high, because the complications with regard to the surgery, complications regarding after the surgery, and so a lot of times they'll actually have to get them connected with a nutritionist or a GI doctor or somebody to help try to get some of the weight off.
But you know what? I love that. In fact, I have a client that wanted a facelift. And the doctor told her, I will not do this facelift for you until you lose 25 pounds.
Yep.
And to me, that was awesome. Very admirable of that doctor because there are side effects to having these surgeries. And,
and they've done some studies, and these are like old studies, but they've looked at the amount of force, because we're constantly squeezed between gravity and the floor, right? It's a sandwich. And so they've done studies on the amount of force through your joints. So when you're walking, so if you're standing, right, I'm a 200-pound guy. So if I'm standing, right, I got 100 pounds on one leg, 100 pounds on the other leg, kind of sandwich between. When you start to walk, every time you take a step, it's 1.5 to 2 pounds your body weight every time you take a step. So imagine being a 300 or 400 pound person.
Wow.
And every time you take a step, that's why it hurts so bad. And so, by the way, when you run, it's 6 to 8 times. That's why when you have arthritic knees, it makes it hard to run. But there's a lot of pressure that goes through there. And so even like a 25-pound weight drop can be significant in terms of the amount of limited forces through the joints as you're weight bearing and as you're walking and skipping or whatever. But in terms of therapy, we don't do too much on the nutritional side of it. Most of our focus is on the movement side, the functional side. But because, I read a lot of stuff. And so, I do educate some things on some. I have to be careful because I'm not a certified nutritionist or, licensed dietitian or any of that kind of stuff. But there's enough information out there that's general enough that you can kind of make some general guidelines for that. In fact, we had Alec on several weeks ago. And so he's actually helped me craft some things that are just general guidelines for seniors to help with that. And so part of the challenge is as you get older, not only dealing with metabolic changes where it's slowing down over time, we're also dealing with chronic illnesses that change the body's ability to maintain energy levels and those kind of things. We may be dealing with the body's ability to metabolize certain medications, and that can throw some things off. And so some things are not as easy as the willpower thing, and it's calories in and calories out, which is what you hear a lot of people say, like Twitterverse, and a lot of nutritionists will talk about. I think it's an oversimplification. In fact, everything that way. I think everything is. It's an oversimplification if you just say, if your calorie expenditure is 3,000 calories a day is what you burn. Then if you're taking in 2,500, then you're in a 500 calories deficit. And so over time, you're going to see some good weight loss from that. There's some other folks who are looking into food being more complicated than just the caloric side of it. And they're actually considering and looking and doing studies on how much of food is actually a software program. So depending on what you're eating, how does that impact what your metabolic rate is going to be? How does that impact what your weight loss or your weight gain is going to be? And so I think there was a guy several years ago. Did you see that he did like a McDonald's diet for like 30 days? Not the guy who gained all the weight, but there was a guy who's like, I'm just going to eat McDonald's. He kept the calories at a certain number. And so all he did was eat various McDonald's meals. And so on a short-term basis, he kind of partly proved that the calories in, calories out thing is a real thing. But I think over the long haul, I think what we're going to find is it's a little more nuanced than that. I think you're going to see there's some software programming. Interesting enough, going along with that, the other thing that is there's some new studies coming out. One of them was like a one-off guy, but it's created some other people starting to look into this. But the sequence of actually how you eat your meals is fascinating. And so this guy was wearing a continuous glucose monitor. And so he would eat the same meals every day. And what he did is he changed what on his plate did he eat first. And what he found was when he ate the protein first, before going to his vegetables and potatoes or whatever else, that his blood glucose did not spike nearly as high.
Wow.
And so the thinking behind that is somehow because of you're eating more of the dense protein first, it's probably slowing down the motility as the food goes through your digestive tract. And so it's probably slowing down the speed of the carbs actually being absorbed into your bloodstream and sugar. So even sequencing of food. So again, this calories in, out thing, there's some validity to that. And I do track, I track my calories and I track macros and that kind of stuff. So there is something to that, but I think it's also, there's probably a large degree of what you actually eat in.
Well,
take
and
in as well.
I have clients that, their downfall is at night. Like when they're watching TV at night or watching the news, they want something to munch on. And so I say, get the junk out of the house. Don't buy that stuff that you love to munch on. Find some healthier options. If you've got to have something to munch on at night.
Yep.
But going back to my grandmothers, my healthy grandmothers that had long lives, they never ate a snack after dinner. I mean, they had meals and bedtime, they maybe had a glass of water.
Yep. I think some of that's trained. Some of it's dope. Some of it's neurochemicals, right? We're trained to, like, it feels good to eat this kind of stuff. And so I need that in the evenings or whatever. But yeah, there's the evening snacking thing can be difficult for a lot of folks. I don't have that issue, but yeah, especially if you gotten used to that dessert, the after dinner dessert, or you're just vegging on the couch and you're wanting something else. I think sometimes just boredom. My kids eat us out of house and home, and I think sometimes just because they're bored.
But I think that's teens too.
Yeah.
That's teens. But we want to be healthier. We want to have 2024 is right around the corner. And, we just want to talk about ways to have a better lifestyle, how to eat better, how to feel better, how to exercise. And so just talking about getting ready, gear up for what you want to do for the new year and how you want to feel. And,
well, and part of it is there's everything's like, it's like a bunch of variables and a bunch of dials. If you're trying to feel better and you're trying to feel more mobile and more active, the nutritional part is really key. You're starting to see now a lot more studies. In fact, there's a sleep center. It's like CBD. There's a sleep center like in every shopping center, it seems like now, because we're starting to realize that how much sleep impacts things. Your chronic stress levels impact your overall feeling of your body, your energy level, like your activity levels. They've done a bunch of studies on the different aspects of exercise, or different variables of exercise, and it seems like if you pull all the stuff together, it seems like where we end up is it's some sort of a mixture between resistance training a few times a week. So that's like lifting weights, lifting things heavier than you. You can use your body weight. You can use bands if those are available to you. If you don't want to go to a gym, you can go to a gym. But resistance training a few days a week, especially for seniors, because one of the things that happens with seniors is that fancy term called sarcopenia, which is age-related muscle loss. And so, and that when you start to lose muscle loss, you start to lose your ability to get up and move around. You start to see more falls, all that kind of stuff. And so you want to make sure you're doing some sort of resistance training to keep the muscles and the bones strong. And then they also have some, you got to be careful with this one depending on how old you are, but there's some need to stress like your VO2 max. And so getting your heart rate elevated a couple times a week for a short period of time has been beneficial. So like doing HIIT exercises or rowing or biking or whatever, for some of us running. And then that piece of it may be hard to do for some of our older clientele, but the other one that's easier to do is something that they call zone 2 exercise, which is just walking. And if you got up and you walked, 20 to 30 minutes a few times a week, that has shown to have significant improvement in not only your mobility, but also what they call mitochondrial health and strength. And so like the mitochondria is like your powerhouses of your cells. So if you're feeling puny, if you get up and walk, you'll actually over time, and it doesn't take very long, by the way, over time, you will find that your overall energy level just from getting up and walking.
I used to walk all the time.
Yeah. And if you walk outside in the sunlight, now I'm going to need vitamin D, which is like the best way to get vitamin D production is through actual sunlight. And that also helps. Like vitamin D helps with depression. So that's another reason why people stop getting benefits. Up. So there's all these things and I think the takeaway for me is there's a bunch of dials to play with to increase your quality of life and your activity level and your energy feeling and just how you feel. And if you can make small changes in each one of those, I think overall you're going to see that the combined efforts of all those things will make you feel better. Well,
and the senior centers all have programs. They have trainers, they have therapists, the people there at the senior center to help seniors on what is best at what activity level is
Yeah.
best with whatever their condition is.
That's
and
right.
I highly encourage seniors to go to those senior communities,
Yes.
to the gyms or the senior gyms.
Yeah. And they do say you can't out eat a bad diet. So as we circle back around to the Ozempic topic and nutrition, like the nutritional piece really is important. And you and I are in a bunch of senior living communities, and we've been in hospitals before. We've seen the menus that are not conducive for healthy aging or really anyone to be healthy, especially in some of those hospital ones. I mean, the pancakes and waffles for breakfast is a disaster. And so, the nutritional piece is really, really important. Making sure you have enough protein intake. We talked about hydration before. That's, by the way, that's the other thing with Ozempic too, as I've read that it's really crucial. And I don't know what the mechanism. Water. Yes, I don't know what the mechanism is on that. But
we're supposed to drink water anyway.
Yeah, but apparently it's even worse on Ozempic, and so they're seeing dizziness and falls from that. So just be cautious with that.
That's good to know.
Yeah,
that's good to know. Thank you so much. This was great. And if you want any more information on Ozempic, look it up online. There are lots of articles about Ozempic. They don't know the long-term effects,
right,
unfortunately. But if you want something to jumpstart your weight loss and you do know that you need to lose weight, hey,
it could be a valid option. And you can also you can talk with your physicians. You can also talk with a local nutritionist or dietitian and see what their thoughts are on that. It's still, for me, I know that there are people who take it. I have patients who are on it for various reasons, and it's done a really good job of dropping people's A1Cs. That resting level of glucose that's in the bloodstream, and but for me personally, I would want to see a little bit longer studies on that before it'd be something that I would consider. But for a lot of people, it's done a lot of good stuff. And I guess Hollywood's catching on to it.
That's right. Thank you so much, Brian.
Welcome.
It was a great show today. And we will return next week. And looking forward to a great week. And I do want to say, I'm the executive director for Pajamas for Seniors. It's that time of year. We are collecting pajamas for needy seniors. We desperately need women's nightgowns. You can get those at Walmart. They're like $15 and all sizes, extra small, all the way to 7X.
Where do we deliver them to?
You can deliver them to the Pajamas for Seniors headquarters, my home at 705 North Church in McKinney, 75069. But we are getting so many requests this year, more than ever.
Oh, wow.
So we want to get as many out as we can. And
are you doing a drop off?
We have a drop off. Yes, Keller Williams, the realtor, they are collecting pajamas. Also, Discount Tires, all the stores are collecting pajamas. Prestonwood Baptist is collecting pajamas. We have a drive-through this Thursday at Sunrise. But just give us a call, send a message at info@pajamasforseniors.org, and we'll get information out to you on where you can drop off pajamas. We will get them out.
Do you need help in delivery?
We need desperate help in delivery.
In nursing homes?
2 nursing homes. Okay. And so if anybody wants to deliver, it is usually a couple of carfuls. So even though maybe a nursing home has 100 residents, it's a lot to get over there. And we not only bring pajamas, we bring socks, we bring toiletries, blankets. So they need everything.
Especially, and this time of year. This is a lonely time of year for them.
Yeah, it's lonely and it's cold outside. Yeah. And, the blankets they have at these Medicaid nursing homes are very thin and flimsy, and just a nice warm blanket. Just, you sleep so much better.
I have been in some residential care homes, like assisted living care homes that are fairly nice, and there's still residents there that are in the hospital gowns. Like they're not wearing their own stuff.
What?
Yep.
Wow.
Yeah. So great. It's a great cause. So
yeah, it is a great cause. And please let Pajamas for Seniors know about those homes, because we can deliver pajamas there too.
To them as well.
It doesn't have to be a nursing home. It can be a residential care home.
Okay.
It can be somebody's home as long as it's easy to get to. We have mail pajamas to patients that are really needing pajamas as well.
Yep. Okay. Very good.
Yeah.
Thanks, Joe.
Thank you.
See you next time.
All right. Have
bye.
a good week.